finally here. I was just telling Kira that there were so many questions I wanted to ask her, and we need to kind of make it good for you and for whatever comes. Thanks for whatever comes up in our conversation. Thank you. I was about to do it myself. I have to tell you, one time I saw Richard Branson, and the main thing he was speaking in the Paris center, like this big center, and the first thing he did was pouring water. So thank you for doing this. I was meaning to do it for you. So first of all, share with us a bit. You know what? I will share before that. For those of you who know or don't know, I mean, there is so much to say. But Dr. Radinsky is the CEO and CTO of Diagnostic Robotics, where artificial intelligence technologies are harnessed to make healthcare better, cheaper, and more widely available. And we're going to talk about it. It's very fascinating, I'm sure, for a lot of people here. You founded SalesPredict, which was acquired by eBay in 2016, and you served as eBay's chief scientist. She gained international recognition and so many amazing prizes and recognitions, over 40 scientific articles, more than 10 patents, including named one of MIT's Technologies Review's 35 Young Innovators Under 35, and 2015 Forbes 30 Under 30, also talked at TEDx, Wired, Techcrunch, Harvard Business Review. She is board member of the Israeli Security Authorities, and so many things, which is amazing to have you here and learn from your experience. And I mean, when we were thinking about this event, we want not only know about what you do and the inventions, but also how you think, how you approach this innovation. And I think the best thing would be to start with what is the driver of your passion to change, what your story is.
I usually use this metaphor with my own PhD students and people who work in our company. I always say that the first step is the hardest, especially if you're a very calculated, logical person. And an entrepreneur is somebody who jumps off of a cliff and then builds the plane while falling. It's just really hard to do the first step in actually jumping off a cliff. So for me, what I do every day, I take the first step without thinking. Okay? I imagine how I want it to be. I don't think too much, because if I would think too much, I wouldn't do most of the things. I think one of the things I usually see is the hardest for people is to imagine things and then not saying to yourself, well, this is stupid. I can never do it, right? What I try to do every time is like, how do I want to see the world, let's say, in dozens of years, and what's stopping us from doing it right now? And I've seen more than one time that one simple action that we've done on a random person on Earth made a huge change for everybody. So that's my driver, pretty much imagining my dreams, kind of taking the first step without thinking, and then handling the consequences.
Can you share your story? I mean, you had, I would say, an interesting story coming to Israel from Ukraine, and how this built you to become a dreamer and a doer.
Right, so I'll give you a little bit of my background. So you can hear from my accent and my first and last name that I wasn't born in Israel. I was born in Kiev, Ukraine. At that time, I usually tell it through the eyes of my own mother. We were Jewish in a country where Jewish was pretty much not the first type of civilian that you can have. In other words, certain universities were closed for Jews. They had quotas. Like in the University of Kiev, only one Jewish person could be accepted per year. And in other words, you could not get any job that you want. You could not get the books from the library that you wanted, etc. So that was pretty much the days that everybody was doing. It was communism was pretty common. In other words, you work at a job, you don't think too much. It's just what you've been told, like you work in a factory all years long. And one day, the nuclear reactor exploded. And people didn't know about that. People were not talking about this on the media. And how did the people know about that? They heard it from the news coming in from the United States, pretty much through Norway. Norway was complaining that those Ukrainians are radiating on them. And then people started saying, okay, something is wrong and my mom is pregnant with me. And everybody was thinking that maybe if the president grandchild is still coming to school, so maybe everything is still fine. One day he didn't come to school. And then my mom was giving private lessons. So my mom, my aunt, my grandma, pretty much everybody are computer scientists or computer engineers at that time. And she was giving math lessons. And one of her students came and said, like, my mom is a nurse and she checked, I'm already active, I'm leaving. And my mom bought one of the last tickets to the train that was leaving to Moscow. Afterwards, they closed all the trains so people wouldn't run away. My mom tells about this scene there where she was standing on the train station with another friend of hers. She was also pregnant. And parents would come with their children and ask, would she mind taking their child with her and a phone number to call when she reaches Moscow. And my mom has a completely big story about, like, in USSR in general, you cannot take hotels. It's only for diplomats. You come to a country like Russia, right? You cannot stay anywhere, and then you have pretty much to manage. So that's what she did. She went to a hospital. She's like, oh, my pregnancy is at risk. Stayed there for 2 weeks, still they understood that it's not at risk. Then she went to some junior camp, and she's like, oh, I'm going to help you lead the kids. And then she understood that she needs to walk like 20 kilometers in a wood as part of the activities, and this is when they understood she cannot do it. And then she moved to the next one. Just moving, she's like, just surviving from day to day, seeing how I can make this happen. And I don't know if you know this, but nobody could leave USSR. They even have an ICD-10, pretty much a diagnosis for people who are trying to leave USSR. The best translation is slow progressing dementia. In other words, those people might not seem crazy to you right now, but they are. Okay? And that would put them into mental houses. You needed to wait for a visa, apply for a visa, and after the USSR fell apart, there was a lot of pressure coming in from the Jewish organizations, mostly from the United States. At least let the Jews leave. And the government at that point decided that, well, we will let only the Jews leave, and pretty much the official reason was they were never citizens to begin with. Long story about how you have to apply for a visa. You have to quit your job. Till you get the visa and you fly, you have like 6 to 12 months that you cannot work. It's illegal not to work in the USSR, right? When you leave, you can take only limited amount of luggage. But my mom had to predict one thing. Everybody knew the Gulf War will start in Israel. And nobody wants to come to a country that they don't know anything about and start with a war, right? So my mom had to predict almost a year in advance when it will start. And she almost got it, but unfortunately, instead of coming after, we came 2 weeks before. She was almost on spot. So pretty much my first memory of Israel is the Gulf War, having gas masks. For Israel, it was a very interesting time. Israel had 5 million citizens at that point, and 1.5 million people came from USSR with no documents, no money, no luggage, pretty much whatever they were allowed just to leave. And then pretty much everybody had to start over, right? There was no houses, no apartments built, no education, nobody knew the language, and the war started, right? So that's the beginning, right? But from what I can remember always, if you would ask me even when I was 4 or 5 what I wanted to be, I always said scientist. For me, it was just like discovering reality about the universe, moving the needle just a little bit. And I admired all of the common ones, like Marie Curie, from just like, oh, not only 1 Nobel Prize, 2 Nobel Prizes. And it's not about the prize itself, about the discovering, the changes that she was driving. And my family wanted me to still remember Russian language. So they would put computer games in Russian, and one of them was pretty much a puzzle. I couldn't solve one of the puzzles. And I called my aunt, and I asked her, like, well, what should I do? She's like, I don't know how you solve this. She writes a piece of code, solves this, and she says, you know what, every time that you're about to give up, you put the numbers here and we'll tell you the answer, just don't use it too much. So I always say that thanks to my aunt, that she was too lazy to play with me on the computer. I coded at the age of 5. I wouldn't call it coding, but running it. Okay. But pretty much since I could remember myself, for me, computers or computer engineering was a tool. It wasn't that exciting. It was like, sure, well, we can do that. It will help us do things. And the first time that computer science for me became a real thing that I understand that can make a difference. When I was 14, I decided to do a summer camp. In the summer camp, you can join a PhD student at the Technion and join them with their research. And I wanted to be a scientist. I wanted to do something in healthcare, and I joined a research study about a real topic, how natural compounds impact the proliferation of prostate cancer cells. Again, I'm not the one who thought about this, I just joined the research. What we were trying to study is if you eat a lot of Brussels sprouts, how it will impact cancer cells. If you're interested about the results, if you eat like kilograms of Brussels sprouts and broccoli, it will kill cancer cells. It will kill other cells as well, okay? But cancer cells as well. But part of the job was we had an aquarium, and we have those cells, and we had to feed them every day to see who survives and who doesn't. And we had one job, not to touch with a pipette on the plate. Otherwise, you can infect all of them. So you can guess that after a week and a half, while I wasn't noticing, I injected an infection, unfortunately, by touching the pipette on the plates. I've ruined pretty much all of her research as a PhD student for the last 2 years, and she sent me and the other student to one of the hospitals to get her new cancer cells. And pretty much from that point on, they said like, okay, Kira, you don't touch it. You just do the analysis. I was like, okay, well, what is analysis? They're like, you need to count how many cells survived. I was like, okay, how do you count? She's like, you look at the microscope and you count them. I was like, what do you mean? There's like 50,000 of them. It's like, well, we have an algorithm. It's like, okay, what's the algorithm? She's like, you divide it almost by 4, I only count fourths. I was like, yeah, that's not gonna scale. That's gonna be the worst summer of my life, pretty much. But my aunt did a master's student in computer vision. Yes, pretty much we all came here as a family. We have no money, nobody worked, but my aunt continued for a master's in computer science because at that time, and even today, we thought like nobody in our family can survive without a graduate degree. So she did computer vision, and I came home and asked her, tell me, how can we solve this? It's like, I heard about some computer vision stuff. Maybe there wasn't too much open source at that time, but she forwarded me to some forum. We downloaded that and did the counting. And this is pretty much where I started falling in love in automating science, or in other words, I wanted to be a scientist, but then I understood that we're still doing science like we've been doing it like 400 years ago, and I want to automate myself. So for me, it is about creating the new version of the scientist. So that was a long answer.
Amazing answer and story. And it seems like your aunt is your secret weapon. So if I'm trying to get what we can take from this story is her aunt. So I think that is the answer. But then again, you said that you grew up with strong women, with, as you said, the scientific mind, and they merge you into this. And even when you said the example of the Nobel Prizes that you were admiring, you said Marie Curie, like you said women, which I'm sure they're also men, but I love to hear about this environment. And now let's talk a bit about failure. So how do you, with again, how you think, how do you approach failure? I'm sure as a scientist, and again, there are always ups and downs. What do you do? How do you learn from them, and how do you approach them?
Yeah, I wish I can tell you that failing is fun. Well, so failing is not fun.
No.
In general, it's tough, right? And I know all of those phrases that will tell you didn't fail, you just discovered 10,000 ways that don't work. That's really motivational, but the moment you fail, that's tough. The only thing I remind myself is every time we fail, and we fail a lot, I think we fail once every 2 days pretty much in what we do, especially if we're doing something in research.
What are like the daily failures that you...
I can tell you about like the one that comes to mind. In my previous company, we were pretty much all of our thought about ourselves was we're the best AI scientists in the world, pretty much the best. This is what we thought about ourselves. And we went into a competition for one of our biggest and best customers. We came into the top 10, they decided to evaluate our algorithms. They gave us a test set, we ran on it, we worked all day, all night. And then we submitted and we were pretty sure we were gonna be number 1. So we came in last. What happened is we had a small bug. Once we fixed it, we were the best, but nobody cares because we had a small bug, we didn't fix the basics. So at that point we sat down and thought, first of all, never think you're the best, okay? It's sometimes hard because then it's hard to drive yourself, but at least have some of the decency to yourself to believe in the truth as well. There's always people who are better than you. And I think when I was in the army, somebody told me something super smart. If you think you're the smarter person in the room, you're in the wrong room. So what did we do from this failure? This failure pretty much changed the way we work. Instead of saying like, oh no, we're the best on top of this, we understand that we have to win by features. We need to do it differently. We need to approach the problem in a more different way. We need to improve our quality. So every failure helped us build to the next level. We have clinical experiments we're failing all the time. It just helps us discover the next steps. And what do I do when we fail? I usually remind myself, it happened before. Today I don't even care about that failure. It's part of just the improvement process, and that's what you do. And as long as you just realize the truth and you don't blame anybody else for your failure, or it's like, oh, I was the smartest, that customer doesn't know anything, the other one's cheated. You always thinking about the inside. What can I do better next time?
I'm sure this type of approach to failure is also something that has brought you to the heights that you have gone to and still doing. Now, you have started researching AI in a rather young age, so this whole generative AI is definitely not new to you. But what do you think about the AI, and obviously the government and the talks about this is good for us, bad for us? So what do you think about it, and specifically in the healthcare medical industry that you work in?
So in general, let's quickly talk about generative AI and what do we think. So first of all, the algorithms, they are super easy, right? All you do is you train models to try to predict the next word. How smart can it be? And we've been doing this for 20 years, nothing new. So what changed? How come suddenly everybody's talking about this? They just trained it on much more data and used much more parameters. In other words, every time we would say like something that predicts only the next word, behind the scenes there's 40 billion parameter space. You can learn stuff, right? I think the first time I saw something that kind of surprised me a little bit is I was playing with GPT 3.5 and then with GPT 4. And I started seeing the advances it was doing. And the only difference is, again, the amount of data and the amount of parameters behind the scene. Storage, think about it this way. The first time I asked, you have eggs, you have a book, you have a nail, tell me how to build pretty much a mountain out of it. It says, okay, take the book, put the nail on, put the egg on top of this, put another book. Then it's like, nah, that's not gonna work, right? And then in GPT-4, it says like something super smart. It take the 3 eggs, unite them. Take another 3 eggs, unite them. On top of this, put a book. And then it started building. So in other words, very quickly, by adding just additional parameters and training data, it started realizing that eggs can be broken and how to fix this. That's already interesting. There's another interesting task. It was published very recently about, can those systems think? And the example they give is just a simple one, like John goes to a room, sees a cat, puts it in the box, he leaves the room. Then Matt comes inside, takes the cat out. And goes on, and at the end of the question it says, what does every person think? And then I asked GPT-4, it says, well, John thinks the cat is in the box because this is where I put him. Good. What does Matt think? Matt thinks the cat is out of the box because this is what he's done. The cat thinks, okay? Everybody's crazy. And I think the moment that the algorithm understood that it also needs to talk about what the cat thinks, that was super surprising for me.
Yeah.
They started showing, they called it the unicorn test. I love that one.
No, not Nokia. Other unicorn, not Nokia.
No.
This unicorn.
We can sing that song later. So what they've done, they showed a really nice experiment. So this is an experiment done by Eric Forbes from Microsoft Research. They asked the GPT-4, draw me a unicorn, but use a specific software. Which software? We have like something called TIGZY. It's something that a lot of academics are using. I don't know why. We thought that it's going to be super cool to code our images. Super hard to draw a unicorn, almost impossible. So he writes it, he draws somehow for unicorn. And then it shows like every time they improve the model, how the unicorn looks like. It almost looks like a perfect unicorn. And still, it's not a unicorn. You look at it and it's like, yeah, it seems like somebody drew it and like almost like a child. So where's the next breakthrough? They said, you can use other tools, and they told it which tool to use. So diffusion models in general, they were giving options of taking an image and improving it with additional text. So they give the GPT this unicorn that almost drew by a child and tell it improve it using whatever other system for image improvement. And then you got the perfect unicorn. So what I see about that one is it's super interesting about how a system that all it was trained on is predicting the next word. If you just add more parameters and data, how it improves. And you see it by the unicorn test. The unicorn looks better and better the more data you add. Now I'm coming back to the question of governments.
Yeah.
So what is so scary about this? It just look really cool, right? It can almost think, it can get to things that we never thought it could do before, and in a very simple way. I think the problem is about the generation of reliable information or what we call the general public fake news. But fake news existed before, and people, playing around with SEO to improve the Google ranking for times, and nobody was, I think we were worried, but not scared to go outside. I think the question here is about scalability. Before this, you needed humans to create fake news, and some of them are pretty smart, sophisticated. Now we have no scalability based on the amount of humans. You can generate infinite amount of fake news without a real way of knowing about this one. And this one is something that we need to start thinking. And more importantly, I'm not sure that regulation is always the best way. My question is, what is the technology that's going to allow us to know if a content was written by a generative system versus not? Now, coming back to the healthcare question, I think in healthcare we're, I would say, one step before, where in 2019 there was a very nice paper published where they were using algorithms, almost in my field, to proactively predict which patients are deteriorating and calling them to meet with physicians. Amazing. What's the problem? They showed the algorithm is biasing against the Black community. They would always rank them last. And you would say like, okay, why? Why is this algorithm so evil? And they showed why. One of the parameters that went into the algorithm is how much did the patient cost last year? Kind of makes sense. If somebody was expensive last year, they will be expensive in the future as well. And then maybe we should treat them. Completely logical. But historically, the Black community was undertreated to begin with, and therefore cost less in the past, and therefore the algorithms neglected it. And we started developing, and we have a really interesting initiative right now led by Mayo Clinic about how do we build validation platforms where we make sure that a machine learning algorithm is reliable, validated, and not biasing against different populations. And if it is, we need to be aware of this. So this is where we are a little bit on that front. But coming back to the generative information, especially in healthcare, we use this in our products as well. So I'm in this field of proactive care. You need physicians to call patients. What we do, we automatically generate personalized scripts who are built to convince the patient to be, for example, adherent to their medication. And each patient has a different history. Each patient has different things that drive them. And we need to personalize some of the information and then learn from this experience. And we've seen that we started getting much better engagement. And the cool piece here is instead of having a human call you and trying to have a conversation, now we can automate parts of it as long as we're driving clinical action. The clinical action is usually determined by the physician based on best practice guidance.
Now, in terms of, let's talk about the pandemic. So Diagnostic Robotics was, if I'm not wrong, starting throughout the pandemics, and during that time there was so much information in real time. It was like the running event. So were there any significant lessons that you've learned through COVID that it helped you discover because of the nature of the pandemic?
Let me tell you what we've done in the pandemic. It will help shed some light. When we started the company, we had several lines of products. One of our lines of products is a triaging and patient intake tool. In other words, it interviews a patient, like inside an emergency department. Today, it's mostly used in college departments. To interview the patient, creates a medical summary, identify who the right physician to meet with, and pretty much we've been able to increase by almost 20% the number of patients the hospital can treat. Amazing. What we started seeing during COVID is we've got approached by the Minister of Health, and they asked, can you use those magic questionnaires, that's how they call triage, and help us identify how COVID will spread? I was like, okay, what is COVID? Seriously, at that time it was like a weekend. We heard like us about some boat in Japan where everybody's sick. It didn't come here yet. And we heard rumors from China that something about coughing. And it's like, okay, so what questions would I ask? It's like, oh no, we need you to think about that. I was like, okay, that's an interesting endeavor that we need to do. So what we've done, we started sending open-ended questionnaires to all of this, pretty much to all the population in Israel. We had 25% of the population answer the questionnaire, which is pretty cool. And we asked them, and they're like, just tell us like how you're feeling. That's it. Like which symptoms? Yeah. Like, and then we correlated this with information that came a week later from the hospitals. Okay. So we started finding really awesome stuff. So I think we were one of the first here in Israel to identify that loss of sense of smell and taste is highly correlated with the disease. At that time, you had to have fever in order to even get a COVID test. Israel didn't have enough COVID tests, and we were trying to use the system to know where to send the COVID tests. So this thing went into our triage system in 3 days. In 3 days, we identified this, approved by a clinical board, and deployed. So what I started learning is eventually asking patients in open-ended questions and then building structured protocols almost in real time during pandemic was extremely helpful in Israel specifically. The second piece we needed to do is predict which patients are more urgent, Again, we didn't know that it's older, younger, we didn't know how it was transmitted. But again, because we knew who's coming to the emergency department and who's deteriorating, we started seeing that the simplest one, sick, chronic diseases, and older. That's pretty much the insight we got at that point. And the way they used this, they had nurses, when a patient would call, nurses would talk to them, and if they fit in on above a certain age group, we didn't know it's 65, at that point we gave it like a 64 or something like that, they would send them directly to a hospital. If you're younger, no chronic diseases, the system started diverting them to, we had in Israel something called COVID hotels. They would actually take a hotel and send people there. But the triaging and navigation system was used through an AI system that was discovering, but all of the protocols were approved by a clinical board. For me, this is pretty cool because still now in triaging, so we have like 100 million medical records. We've seen patients, we already know what are, I wouldn't say the best practices, let's say the best average physicians are usually doing with chronic patients, and we're just mimicking this. This was the first time we had a disease that nobody knew about, and the algorithm had to learn what it actually means and navigate the patients.
So how does this discoveries help to what you're doing today at Diagnostic Robotics?
I think it's about how you ask the question. I'll give kind of before COVID. One of the first time we've been doing is trying to understand how to ask questions from a patient that they will actually understand. I think my best example, we trained machine learning models, their area under the curve was about 86. In other words, like we were highly correlative with what physicians are doing. And when we went to our first prospective trial, if we're talking about failures, we got to almost a random result. And I'll give you an example why. When you asked a patient, okay, patients come in, they have a chest pain, it radiates to the left. How many times would the physician agree with them? Less than 5% of the times, okay? And the reason is not because the physician is not listening, they just don't agree with them, okay? I think my best example is inside the emergency department, you usually ask, is this the worst headache of your life? Why? Because you want to know if it's a stroke. All patients answer yes. This is why they're inside the emergency department. So the right way of asking this, and only more senior physicians knew about this, they would ask, does it feel like a lightning hitting your head? Does it feel like a hammer hitting your head? They have those metaphors. But the algorithm learned this from medical summaries. In the medical summary, physicians never wrote how they were asking the questions, just the answer. The patient says it's the worst headache of their life. But what they asked was completely different. So it took us years of prospective trials to really understand how to ask the question in a way that the patient would answer something that the physician would agree with, okay? The same thing with COVID, okay? Even the simplest thing of like, did you lose your smell? Did you lose your taste? Did you lose both of them? What does it mean to lose the smell and taste? Should you show them an image? Should you show them how does it feel like? It's all about how you ask some of those questions, and we just built an iterative system that we would compare to what physicians are doing and improve the way we're asking the questions.
I read in one of your interviews that you said that when you were younger, you wanted to become a doctor, but then you realized that blood is not really something that you enjoy seeing. But today, you're actually impacting the medical field through science, through the aspect of science. So that's amazing. And in terms of, so what is the future? We're taking the predictive models, and what is the future of medicine through your work, through the personalized medicine and predictive models?
So the problem I'm thinking about right now is, I'm not worried about, well, I am worried about pandemics, but I think I'm worried about a pandemic that's going to happen in less than 8 years. Till 2030, we're supposed to have almost 3.8 billion people without access to primary care. Why should we care? Today in Israel, waiting 3.6 hours on average inside the emergency departments. In China, people are already waiting 8 hours on average. Okay? And that's pretty much what's going to happen. And we already saw during the last pandemic what happens when you have a stress on the healthcare system. It hurts economy, it hurts the practice, so eventually we all stay at home. And a lot of the things I'm doing is how do we significantly change the way we're doing primary care? In Israel, a primary care physician has about 1,500 to 2,000 patients that they have to take care of. You think it's a huge number, but in the United States, it's already 5,000. In other words, they cannot really track everything those patients are doing. They cannot really treat them. All of the data is dispersed in different locations. So this is the problem we aimed in solving. And the question is, how do we get to a point where we present information to the physician, which is completely summarized, instead of telling them we'll replace you as a physician, do the diagnosis. I'm not a believer in that. I think physicians are not too bad in doing diagnosis, to be honest. I think there was a huge waste of time in intaking. What does it mean? Asking the questions, writing the medical summary, writing a diagnosis so the health plan, the payer will actually pay you for this. Patients are coming to you, it's like, why did you come to me? You need to see the radiologist first. You go to the radiologist is like, why did you come to me? You need to see somebody else first. All of this wrong navigation is creating huge waiting lines. I'll give you an example here in Israel. In Israel, one of the biggest problems we have is waiting time for specialists. For example, for physical therapy or a neurologist, you can wait around 9 months. Why? At some point, the HMOs decided that they want to compete with each other. So if before you should go to the primary care physician and they would decide if you can go to a neurologist, here they said like, oh, you can decide whatever you want in our HMO, come here. So what happened is people started becoming their own primary care physician and going to whatever physician they want. Huge problem, creates a lot of stress, people coming, you can wait 6 months, come to the completely wrong physician, and more than this, you're losing the relationship with your primary care physician that eventually has to reconcile all of this information and make a next step. So what we started doing is identifying those patients who got lost, sending them proactive questionnaires, exactly like a primary care physician would do, asking them the questions, saying like, you know what, we'll find you an earlier appointment this week, not in 6 months. Would you like to try it? It's with your own primary care physician. Yeah. Almost 85% of the people agree. And then we managed to divert almost 30% of the traffic from specialist back to primary care. Another thing that we're doing, I think, if you had infinite amount of time, let's say you had 400 patients and not 1,500 patients, you would read all their charts. Yeah. Okay? You would read every time they come back from hospitals, you would read what happened to them. But unfortunately, we just don't have time. So what do? We're trying to identify using AI patterns of patients before they deteriorate and what clinical next step will prevent this, and then proactively alert the physician. Sometimes the physician doesn't need to do anything, right? Sometimes it means they have to go see a nurse, sometimes the physical therapist. So the actual scheduling we almost do automatically. We want to make sure that the physician sees the right patient at the right time with all of the needed information. I think this is the first step for primary care. The next thing I'm doing, so I'm still a professor at Technion, so we're doing a lot of work in machine learning from digital healthcare till pharma. And the biggest thing I've been seeing right now in pharma, everybody was talking about like how AI will generate the next drug. And specifically during the pandemic, we saw how mRNA can be very influential. So we started a company with Professor Avi Schroeder, Yogev and Rui, are the amazing entrepreneurs who are actually running the company called Mana Bio. What the company is doing is it's getting an mRNA and using AI, it creates, think about this as a shuttle to get this mRNA to a specific part of the body. Let's say only the liver, only the heart. Why is this important? There's a lot of diseases that only happen in those organs. You only want this organ to generate a certain protein behind the scenes, which is missing to the body. And in less than 3 months in mice, the AI identified formulations which were patentable and reached the liver, the spleen, the lungs, all in 3 months in mice. So now the company raised a significant amount of funds from one of the leading investors in the world, and now moving to more additional clinical experiments coming in monkeys and then in the future in humans as well. But for me, if you're asking about like what's the generative AI piece, it's an AI system who receives an mRNA and almost in a personalized way generates a shuttle, right? Think about this, like everybody can create astronauts. The actual mRNA takes like 2 days to create. The shuttles, we had only one shuttle. We were so lucky it worked during COVID. One of the companies who failed clinical trial, but like the last one, is because of the shuttle. It didn't work for them. And here, in 3 months, and again, yes, it's in mice, still not proven in humans, but the cool part is, in 3 months, it already got to tens of shuttles that in the past took almost 20 years to create. So it's about making discoveries in a much quicker way.
That's so fascinating. You're in the forefront of the science, and you're making a difference with what you do. And the main thing I wanted to ask actually around this is I read an article, and I think we also talked about it a bit, about your interest with death or pushing death. So if you can share a bit about that, and where is humanity at the moment when it comes to pushing death?
Yeah, I'm not interested in death. Strike that. I'm talking about longevity. Okay,
yeah, longevity.
Okay, what does it mean even longevity? So the first step is, first of all, we're a growing and aging population. We cannot continue in the same practices that we were doing in medicine, let's say hundreds of years ago. We need to get to a point where we at least have a scalable primary care infrastructure. That's my day job. It's like, let's start with the problems of tomorrow before we treat all possible disease, because this is happening. I'm not talking in ages, I'm talking until 2030. That's not in a long period of time. Now, a lot of those diseases, if you look at the graph of how long people were living, so from average, it's funny, you see like in the UK, the average was like almost 50 years at the beginning of the 1900s. We're like at the 80s now, right? So we're growing and aging, not a secret. And if we continue this extrapolation, it means the person who's going to live 200 years had been already born. Okay. Now, I'm going to say why this is not shocking, and I'm going to explain about, it's not my company, but I was really excited about this technology. Almost 2 years ago, there was a really nice development where you can take any cell of the body and move this to almost its embryonic state. Okay, so even before the stem cell. The person who discovered this got a Nobel Prize, so it was a really big deal. So this really smart professor from Weizmann Institute took cells, first from mice, by the way, now from humans as well, brought them to the embryonic situation or type or first stage, whatever you would call it, and actually grew an embryo which is a completely exact clone of that person. They actually did a change so the head would not grow, and they showed that with mice, they almost got them born. Why is this interesting? Interesting here, they called it synthetic embryos because they actually grew them in a synthetic womb, pretty much like a robotic system that turns them around. But here, at day 40 of a synthetic embryo, you already have eggs. So women that let's say after the age of 40 want babies, we can create the babies from every cell that you want. Just give us a cell, we'll create it. That's pretty awesome, right? I think one of the things that prevents longevity is many times the immune system. It gets old, right? Think about an injection of an immune system happening every month. Now, this sounds sci-fi, but I'm talking about existing research happening right now and results, and I know it's in mice, but this company has already grown human embryos. They need to reach only 60 days. They're not too far, so let's say almost in 20 days. But from the progress I've been seeing, I don't see a reason why not. So this is why I'm fascinated in general longevity, because not because it's futuristic, not because everybody thinks it's impossible, it's just because it's here.
It's here, yeah.
Right?
It's here, exactly. And now let's talk about the handle of responsibility. Eventually, when you're doing the predictive, if it's science or social events, like it was, I think, with Deborah, with the Microsoft system, that you were predicting different riots or war or things around the world. How do you handle the responsibility that comes with the power of predicting the future, predicting results for patients, for example?
So I'll tell a little bit the background story here. So during my PhD, I was building an AI system who read all of the news articles, try to identify patterns and predict future events. So one of our main discoveries, we identified that if there's a drought and 2 years later you have huge floods, the probability of a cholera outbreak is very high, but in very specific locations in the world. And the algorithm actually gave a full description of what's so unique. And it actually was proven during the last cholera outbreak in Cuba. It was the first one in 130 years. We knew about this almost, I would say 2 years in advance. We got the first alert, but we ignored it. But almost 6 months in advance, we actually took action. So for me, this is a good example. You can actually do something. What did we do? We did something super simple. Cholera is a disease that kills 100,000 people every year. But it's very easy to treat if you get clean water, that's all. In time, mortality rates drop from 50% to less than 1. So you just need the logistics of getting the clean water. But what I learned is making a prediction is not enough. It's all about the intervention. I'll show you in another example. We were able to predict the Sudan riots in 2013. Our system identified an awesome pattern. If you have a subsidized product, you stop subsidizing it. You're going to have students on the street. They're going to have major riots. If the police kills one of them, you're going to have huge riots. And again, only in countries where there's a huge difference between the rich and the poor, a lot of characteristics. The system gave it full mathematical equations of characterizing them. But what do? I'm telling you, there's in 2 weeks a riot in Sudan. So the idea at that time was, well, this is we'll come in, we'll educate them. I was like, try to educate a very angry crowd.
Yeah.
Okay? So this is what we learned. It's not about knowing that something's going to happen, it's about the actionability. So how do we use this? Even in medicine, some patients will deteriorate. many times I'm telling you, hey, he's a patient, he's sick. It's like, I know he's sick. What do you want me to do with him? I'm like, that's what happens. There's nothing science can offer us to help.
Yeah.
So we started changing the way we work. Instead of predicting who's going to be sick, it's predicting who you can prevent from being sick. It's a completely different question. It actually made us create ontologies. When you look at a case, you think whether it could have been prevented. How do we know this? 60 physicians sat and built an ontology. It's like, oh, if it's this ICD-10 and they've done this thing inside the emergency department, then it means it could have been prevented. Did 15 years of prospective trials and said, oh, our ontology is almost there. So what we built is an algorithm that build automation about this type of ontologies, and then try to look at those patients 6 to 12 months before those preventable events. So the responsibility, first of all, predicting things that people care about, okay? And it's not like we don't care that somebody's sick, we just don't have anything to do about this one. It's about deploying them in workflows they could use. Another example, it's really nice, we're showing really nice reports to the administration of the hospital. If it's not in the physician's desktop, when he meets with the patient, he's not gonna do anything. He's not gonna work with 5 systems. It's okay, I'm taxing him. He has to meet a patient every 4 minutes. He doesn't have time, okay? So it's all about integrating into the workflow and making sure that the actions are correct and followed up, and there's a learning cycle all the time.
And when such technologies, I mean, some of them are already in place, or are we expecting them in the next years or 2?
Well, our systems are treating 28 million patients monthly in the United States. When I say treat, we evaluate, see if they have something that can be prevented, and push this to physicians, either through the payer or working directly with the physician groups.
Now, in terms of diversity and inclusion, obviously I know you speak a lot to women. You also teach at the Technion, so you meet the younger generation a lot. So I want to know how do you find the women, to get more women into entrepreneurship or into medical or science on the one hand, and how do you see the younger generation in Israel in general?
Yeah, so I'll share a little bit about my experience. So first of all, I grew up with a family of only women. Right? I grew up with my mama and my grandma. I didn't know there were certain things I was supposed not to do because I'm a woman, right? Seriously.
Good.
Like, you need to paint something, you paint it. You need to build a wall, you build it. We never thought about what's feminine and what's not. Well, you have to get along. You need to survive your life. The first time I moved to the United States, I was 21. There was a conference only for women, and they talked about the glass ceiling. And I remember asking the lady sitting next to me, it's like, what is a glass ceiling? She's like, it's like you cannot get promoted. There's a glass. I was like, I don't understand what you're telling me. It's like, I really couldn't, right? But again, we cannot argue with the numbers that at this point, there isn't enough women entrepreneurs. It's 8%. How come? But if you look at what was changing, right? 100 years ago, okay, women were not working, right? Women could not vote, right? Look at where we are right now. It's part of a process. At a Technion, I think last year it was 38% women in the computer science department. Okay, so we're in a transition phase, right? I see more and more women going into computer science. I need to remind everybody that computer science started for women. Okay, we got to the moon because women were working this because it was considered a feminine work. Okay, only when it became more and more advanced, you started making more money, you started seeing more and more men moving into that one, and then it stopped. You need to remember the origins of a lot of those things as well. Usually, I would say the biggest change that happened that allows a lot of the progress of women is getting to a point where actually giving more rights to men, and I'll explain. In Israel, maternity leave is the first time we started seeing a difference between men and women in their career. So before they actually give birth, there's no difference. They progress approximately the same way. We see the numbers of women going into science is growing. So everything was in the right track. And then it splits. And then you see salary differences. And when it turned out that although we progress, still the responsibility of the family is traditionally considered to be on the woman. So what the biggest change that started happening, and by the way, it started from the United States and we started copying here as well, is giving maternity leave also for men, paternity leave. So in the United States, it's the same. Nothing, but still the same. Okay. So in Israel, we're starting a little bit to promote into this direction. And the idea is just discriminating an entire age group okay, instead of a certain gender.
Yeah.
I think starting from really early on to talk about the fact that a family is not a responsibility of you as a mother, it's you as a couple, right? And from this point on, actually starting to grow. And this is something that you cannot teach this, you need to show this, right? And it's how we build families. In Korea, at some point I understood that they're not going to have enough population to support the retired population. They had one child. And they started building all of their books in a way to promote people to have 3 children. How? They would show on TV a family with only 3 kids, smiling. A book of a happy family had to have 3 kids. So a lot of this, let's say...
Designing thoughts or...
I would call this marketing, right? It was a deliberate marketing to encourage the population to have kids. By the way, in Israel, we're doing the same thing for ages. Okay, Israel has the highest amount of kids per secular population, I think, in the world, right? Almost 3. How did it happen? You see, oh, every family has 3, right?
Yeah.
In the books, it's 3. And then you have things like, oh, if you have only girls, you need to continue, or if you have only boys, you need to continue to have, like, for both genders, right?
Yeah.
The same thing about, like, the structure of a family. It's about how we decide to project this. If we show all the TV shows with both men and women, both of them taking responsibilities, and not only the woman staying at home, you see more women who are doing science, and this is the main show. And there's a lot of changes that are happening right now, but this is something that we need to be aware of. At the beginning, it's going to be a little bit artificial, but it makes a difference.
Yeah, and as you said, eventually we're being designed through the media, through, I know, for example, the LGBT. I remember the days maybe a decade ago where Asi Azal or some figures who were from this community were like, oh my God, weird, and then you see them more and so on. So that's definitely interesting. And if we're talking about the family aspect, so if I may say, you met your husband at the age of 8, and and let's talk about the dissonance between having such an amazing and global career and demanding career, and then having a family and kids. How do you find this magical formula? How does it work for you?
First of all, I always said that the first 8 years were a complete waste, right? We were neighbors. We both were immigrants from Kiev, Ukraine. We're just friends, and we grew up to be equal partners from all the time. And a lot of the things I am right now is because of him.
He's also a startup founder, right?
He's a CEO of a very big company focusing on AI. So we pretty much developed to be very similar individuals. But in all decisions we were making them as a family. And many times I had to go do I was finishing my PhD. I was offered a professorship in one very leading university in the United States. Like, I'll leave my work, I'll come with you. If it helps you, and then one time you'll help me. You'll make a decision that is going to help me. And every time, I think at some point he even took it too far. He was always saying, like, first of all, we have an agreement when we get married. First you and then me. It's like, well, this is not fair. It's like, I'm proud of being a husband of somebody successful.
Wow.
Right? At some point, the reason he was taking this too far, we went to a party. The way he introduced himself, he says, like, this is Kira, and I'm your husband. He didn't even say his name, right? But for him, it takes huge pride of saying, like, I am involved, and I made this happen, and I'm part of this. And for him, it's part of his goal to help me be more successful. And I see this as my goal as well, about him as well, right? It's thanks to him I saw how you can do it, and I'm trying to project back at him. But I have to admit, he was the one who initiated.
And if from what I read in the media, that you actually met when he was solving like a physics problem or something, is that true, or it's just a rumor? Fake news.
No, it's not fake news. So we're very young, and I was sitting in a bus. I was doing my homework, and he sat next to me and was trying to make a conversation. And I was like, listen, I'm doing my homework, right? And it's like, he even remembers, he reminded me a few days ago, it's like, do you remember what I asked you? It's like, wow. It's like, what do you want to be when you grow up? And you told me I wanted to be a scientist. It's like, yeah, that's my real answer. And he said, like, at that point, I wanted to show you that I can also do something. So what he did, he saw which exercise I was doing, and he took the one which was the hardest. It was literally one that, like a bonus question. And he spent a full day, he said, I wrote it 5 times in my best handwriting. And he came an hour before school to find me, and I was the only one in class who solved it. So I always told him, like, once I saw that you can do something I can't, I said, like, oh, it might be interesting.
Taken.
Right?
That's amazing. I love the story. And I mean, you have done a lot and so much. And on the one hand, I'm sure there are a lot of expectations from you, from the scientific community, from governments, companies, communities, and so on. But my question and what I'm interested to know is, what are you expecting from yourself? What do you want? Where do you want to go? And what are your expectations from yourself moving forward?
When you decide to be a scientist,
Yeah.
you understand that you're not going to make a huge breakthrough. It doesn't happen this way, okay? It's like you make something small, another person makes something small, and then this is how we grow the knowledge. Somebody gave a metaphor. It's like a ball, and then you push a little bit with a needle the boundaries of knowledge.
Yeah.
So for me, a full success is pushing the boundaries of knowledge.
Yeah.
How much? But even a little bit. And I think creating the infrastructure for others to make those discoveries is also my success. At this point, again, especially specifically in AI, and I'm really excited to see how it can generate solutions to things that we have no idea how you're going to do them. I think what bothered me the most is developing a drug. It can take like 20 years, 12 years at least, $3 billion. We did one experiment, a retrospective experiment. We applied an AI system, a generative model, on all the data we had as humanity in the 30s. And we told it generate drugs. And what I was hoping for is we generated 1,000 molecules. I said, like, if one of them really passed the FDA, this is how I'm going to call the paper. The drug that could have happened, right? And it turned out that out of the 1,000 it generated, 35 were discovered more than 20 years later. What does it mean? It means that all the knowledge humanity needed to make those discoveries. One of my biggest example is tuberculosis. We could have already made it in the 30s, but we made it only in the 50s. Why? Because it's a needle in a haystack. And I think this is where AI comes in, helping us, automate us as scientists. So what do I want to do? I wanted to be a scientist, but today I want to automate myself.
And so first of all, thank you so much. This is a big round of applause for Kira. Thank you so much. Everything you shared, from how you think, how you approach your knowledge, everything is so fascinating, and I would have loved to dive deep into more. And thanks so much for sharing your amazing activity with us. And now, guys, moving to you. So what are your questions for Kira? Yes.
What are your kind of programs and ways?
Can you say it again louder?
What are the ways what do you do to find problems that you want to solve?
So what do you do to find the problem that you want to solve? That was the question.
I always say problems find me. But
Ooh.
I'll explain. When you only start your scientific career, you look for problems. The more you evolve as a scientist, you start understanding how many things you still don't know. Okay, you usually need to set like an end goal. For example, I want to get to a point where our algorithm is creating generative molecules in a much faster way. And you start empirically testing this. And every time you do this, you look at the data and it's like, oh yeah, I didn't think about that. We needed this type of data, for example, right? So usually it's an iterative problem. Every time you discover a new one, and then you solve it. A lot of the things I love a lot about the new generative models that you see right now is they know how to break down the problem into smaller problems and then solve them. So that's what I usually do. I set up a larger vision that I know is like, almost looks impossible. And then I try to track it back and then find small problems. But in practice, sometimes I have a discussion with a professor from another university, and then we make a joke like, oh, wouldn't that be funny if it could do it? And then, maybe it can, right? Yeah. That can be a fun experiment. Especially in research and academic work, you can do a lot of things which are just for fun. And more, I would say, in industry, it's very driven by the ROI that you bring, feedbacks that you're getting from customers. And the best thing I receive is bad feedback. Seriously, my best customers did not believe. Okay, and they said like, I don't want to use this because. Okay, I don't like this because. And when they become a believer, you understand that you've done something. In other words, they find the problems for us.
Yeah. Thank you. Yes.
Yes, hi. I have a question related to that, because in the digital healthcare sometimes talking about artificial intelligence, although it's not a new technology, it has several years. Talking about with the doctors.
I get to feel it.
I think that the challenge for the people in the how can you deal with the doctors that they believe that something like artificial intelligence helps in your perspective? I'm from Latin America, Mexico. We are going to implement artificial intelligence for monitoring pregnant women with high risk. I came with my sister. I'm very proud of her. She's a doctor in charge of 100 women every day with high risk. And I want to translate all his knowledge to make decisions. But it takes me like 6 months to convince her, because at the beginning for her was, no, artificial intelligence is not the right thing for medicine.
Yeah.
I appreciate your experience.
So I think the first thing is not to annoy somebody, right? So when you come to a physician who likes doing diagnosis, and they like doing diagnosis, so like, you know what, I'm gonna automate that, right? It's not gonna work. You need to select something they don't like. So what we've done, we selected documentation. Who likes documentation? That somebody else should do it. So we automate documentation using generative AI. And then we said, you know what, did you notice that the patient answered, let's say, in Spanish, but the medical summary is in English? Isn't that cool? It's like, yeah, it's saving tons of time. Actually, that's still what the patient wants. I was like, how about instead of you writing the claim and submitting it to the health plan, we'll do it for you. How about that? That's annoying. You as a physician need to do the interesting stuff. We want to make you more time. It's like, yeah, we'll do that. We'll do that. You build it from the things they don't like. Okay? At the end, you're asking me, in radiology, for example, they already reached really high diagnosis precision in MRI, X-rays, etc. And still physicians like, yeah, well, you're not going to replace me. So what do? You say, no, it's a workflow system. I'll explain. The moment an AI system identifies that there's this diagnosis, you need to call the physician, right? He's on another floor, he needs to come down, right? We need to know which room. It's just for logistics, right? And to be honest, I think this is the best place where AI fits in. It's just getting ready for things that just logistics and administration in the office, that's are boring things usually, right? So this is, I think, the easiest place you come in. And then with time, it's just like, oh, we can have just this small feature that every time that you look at a patient, we'll show differential diagnosis. We're not doing this for you, we're just showing you for FYI. Using UpToDate, so it's pretty much like a website where you can put in like symptoms of a patient and it gives you a diagnosis based on clinical protocol. So it's like, we just put UpToDate here, it's no AI. With time, we're gonna show him a little bit of AI, say like, oh, generated by AI. They'll start seeing it's very similar, and then start trusting it, okay? So the simplest answer, don't be annoying, right? Don't tell them something they like, it's gonna be replaced. Start with the things they don't like. And it's about any technology, not only AI. For me, I don't believe AI will replace physicians, right? I think a big part of the treatment is the relationship. I think adherence of patients, or compliance, whatever you would call that, is so much more important than anything else. And I think the problem physicians have right now, they don't know if the patient's not compliant. They don't know if they don't have access to food. You give them pills, they went to the hospital, they changed them the pills, now they come home, it's like, which pill I'm supposed to take, right? So knowing what's happening behind the scene. I'll give you an interesting pattern that we identified. We started seeing that patients who are doing a lot of MRIs on different parts of their body, they deteriorate really quickly. So I showed this to a physician, it's like, so what do you want me to do? Stop giving them imaging? If the patient needs it, we'll do it. It took us a long period of time to understand that this is actually a sign for undiagnosed depression. So the patient either has somatic pain, seeks attention, who knows what's actually happening, but to address it, you need to address it in a psychological way, right? So using AI to actually tell them, we've noticed this, in the past this was what's happening with the patients, showing examples of those patients helps convince. And of course, the usual scientific way, if you show them a clinical trial, treatment control group, many of them would not argue.
Thank you. Yeah.
Kira, at least in my country, there's a huge gap between academia and the business world. In your personal experience, what are your benchmarks to reduce this gap along the way?
I think this is about finding the right problems, right? When you're only in academia, you invent your own problems. Oh, it's interesting, we'll do that. And it's okay, we need this type of almost random search as well, right? In the industry, eventually you have a very as a company, you have a very specific ROI, you need to improve the income of the company, the revenue, the profitability, etc., and everything is driving to this one. I'm gonna give a little bit of a rudimentary answer, but the collaboration between industry and academia is helping share at least the problems. So even the fact that in Israel they started giving a day or two for academics to work in the industry, for them it's like, oh, I'll make some money, right? For us, it's about them understanding which problems the industry really cares about right now, and not only futuristic things that might not even come.
And we have a space for another short question. Anybody? Yeah?
Hi, Gary. I want to ask you, how far do you think we are from personalized medicine and like personalized longevity? Like kind of like what Brian Johnson has been doing?
Yeah, we're already doing personalized medicine. You're all getting treated by personalized medicine, right? Today, based on the medical information that we store in electronic medical records, patients are being treated in a more personalized way. There's nothing new about that. A lot of the studies that we've been doing is just using this data in a smarter way. I think what we were referring to when people usually say like personalized medicine, you say like, oh, let's just have everybody's genetics and the algorithm predict from genetics, etc. Israel is now running a program to sequence almost 500,000 also healthy population, okay? Which is new. So in the UK they have approximately the same number, but only for the sick population. Here they're going to do it for everybody. Okay? Once we have this data, we can start building a research and try to find the correlations. I don't think the problem is in the algorithms. Even the example of GPT, think about like all those transformer models, etc. All they do, they predict the next word. There's no huge algorithmic gap. It's about how much data can we store, do we have the right data, and do we have the computing power to do it. So is it far? No, I'm telling you, like from GPT 3.5 to 4 to 4.1 to 4.2, I'm looking, it's like the jumps are huge, huge. So I'm not worried about the algorithmic part. I'm thinking about, do we have the computing power? Yes. Do we have the data for personalized medicine? Not yet. Can we do it? Yes. The actual hardware to do it is getting cheaper and cheaper. Israel just bought a few serious machines. So I think in 10 years we can start doing this in a much more scalable way.
It's so amazing to know that someone like you running and driving the science forward, and I'm really looking forward to seeing what else, the next amazing things that you will do and impact so many people. So thank you so much for making the time, for coming here, for finding the parking lot, for sharing so much.
Sure.
Really, she deserves another round of applause. Thank you so much. Now, before we finish,